Thank you for listening to Depictions Media Radio. So, Dr. Bonnie Henry is going to speak in a few minutes about lifting restrictions if you have been vaccinated for visiting people or loved ones in long-term care homes. That you may not have to schedule an appointment. There's still going to be mask wearing in common areas to ensure maximum protection of the elderly living in the homes. If you have not been vaccinated, you're still going to need to follow a lot of the same restrictions that were in place during the entire pandemic. There is still a lot of talk around for those who have not been able to get vaccinated. The number of restrictions that might still be in place. There are still some areas that they're still trying to get vaccine into. If Dr. Bonnie Henry will discuss that also. But for the most part, if you can prove that you have been vaccinated, you by the end of July, you will be able to see your loved ones in long-term care freely and easily. So let's listen to what is actually said in the press conference.
Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. We're here today to talk about long-term care and seniors assisted living and visitor restrictions that have been in place in different forms since March of 2020. Everyone will recall and knows who lives in long-term care, who has family members or friends in long-term care, the challenge of the COVID-19 pandemic for everyone in long-term care. We're honored today, Dr. Henry and I, to speak about this on the territories of the Musqueam, of the Squamish, and of the Tsleil-Waututh First Nations. Today, in the regular report you would have received on COVID-19 cases in BC, you'll note that there are no longer any outbreaks in long-term care homes in BC as of today. There's a care home in Dawson Creek, the Rotary Care Home in Dawson Creek, that had an outbreak declared over just in the last couple of days. As I say, since March of 2020, there have been restrictions in long-term care. You will remember that on June 30th, 2020, changes were made to allow visits in long-term care, social visits in long-term care, and then again on March the 23rd, further changes were made that significantly expanded the number of visits in long-term care at that time. They were done because of the significant success of immunization in reducing transmission in long-term care that occurred at that time. And we're happy to announce today a series of changes. I'm going to just briefly detail them, and then Dr. Henry will go into them in greater detail. The first significant change is that visitors will no longer need to schedule or book in advance to visit loved ones, and the limit on the number of visitors for each resident will be removed. Fully immunized visitors can visit with residents without a mask. Larger, facility-wide social events or gatherings are safe to be held again in long-term care and assisted living. Indoor gatherings may include residents and staff across units of a facility, while outdoor gatherings may include family and friends. In addition to the changes in long-term care and seniors assisted living, adult day programs for seniors and in-facility respite can fully resume, providing additional health and well-being benefits for seniors and caregivers in the community. Those programs are essential to seniors programs in BC and seniors care. They, of course, have been interrupted in the course of the pandemic, and those changes are significant. We also want to note that there will be new requirements, that these changes will come into force on July the 19th. This will give both care providers, long-term care workers, and ourselves a chance to work through all of the details so we're fully prepared for these changes. But these changes are coming, and they are going to make, I think, an important difference for everyone who lives in long-term care, and especially and as well their families and their friends. It will be able to allow, within significant, with continuing restrictions, some continuing restrictions, for the safety of people in long-term care, but true, even spontaneous, unscheduled visits in long-term care that will allow, I think, a return to a sense of normalcy and social activity in long-term care. I would note that there will be other changes brought into effect that Dr. Henry will speak about. They involve, in some cases, provincial health orders, that long-term care and assisted living workers will be required to report vaccination status to their employer. Workers that are not fully vaccinated will be required to wear a mask at work and be tested for COVID-19 using regular rapid tests. Volunteers and personal services providers entering long-term care settings must be fully vaccinated. Masks will be required for visitors who are not fully vaccinated. Masks will not be required for visitors who are fully vaccinated, except when traveling through common areas of a care home. In other words, when arrives, when goes and visits, and when the visit occurs, when both the resident and the visitor are fully vaccinated, can be done without masks. And each site will continue to maintain a sign-in list for contact tracing purposes and actively promote adherence to all infection prevention control protocols. It's just been a long time coming, and everybody, I think, who, as I say, associated with long-term care, understands the consequences, the necessary consequences, but the consequences of restriction and visitation in long-term care. We have, of course, made two significant sets of changes before, last June and again in March, but today's changes will allow, I believe, some return to normalcy while continuing to have safety in long-term care and assisted living. And the changes to resume adult day programs, the changes to resume in-facility respite will make a real difference for seniors everywhere. I want to acknowledge the exceptional work done by everybody in the long-term care sector, of people who provide personal care to people, who have gone above and beyond the call of duty throughout the COVID-19 pandemic. This is an important day. It reflects the progress we're making. Today, as you'll know, more than 79% of adults, more than 78%, 78.4% of all those over 12 have received their first dose of a COVID-19 vaccine. And significantly over 40%, 44%, I believe, of those over 18, 42% of, should I say 42% of those over 18 and 40% of those over 12 have received their second dose of a COVID-19 vaccine, numbers that will be significantly higher when we arrive at July 19th to these new changes. So the circumstances are in place. Again, no long-term care outbreaks. We have significant decline in test positivity for COVID-19 and reducing cases. And in the long-term care sector, overwhelmingly, staff and residents have received both doses of a COVID-19 vaccine. In other words, it's time for a change, and it will make an enormous difference. I say it as at a personal level. For like you, many of you, I have loved family in long-term care. And as for everyone involved in the system, this will make, I think, a significant difference in bringing life back to normal after a very challenging and long response and limit on visitation in long-term care. It's now my honor to introduce Dr. Bonnie Henry to give more details of these changes.
Thank you very much, and good afternoon. And I don't need to say that it is an important day for everybody, particularly for seniors and elders living in long-term care and seniors assisted living, and for those who have family and loved ones in care. The past 18 months has been dramatic on all of our lives, but no more so, and no more people are more severely impacted than seniors and elders in our long-term care and seniors assisted living. They were the first to suffer severe illness from COVID-19, and you will recall our first deaths were at a long-term care facility here in Vancouver, and really was a harbinger of the heartbreak that was to come in many, many places. We acted quickly to reduce risk by putting in outbreak measures that included restricting visitation very severely for the early parts of this pandemic. It was an incredibly difficult decision to make when we know that social connection is so important for seniors' health and well-being. But until a vaccine was available, it was a necessary and important step for protecting people in these most vulnerable situations. Later, we prioritize people living and working in long-term care and seniors assisted living for immunization. And our intent was to protect those who were most vulnerable first, to try and reduce that devastation that we had seen. And we are now seeing the positive outcomes from this. Today, the vast majority of seniors in care and residents and workers are vaccinated, and we can see that light at the end of the tunnel. Our ongoing vaccine effectiveness in long-term care tells us that the vaccine program that we have is working and continues to work to protect those people who are living in those settings. And that is really good news. And we saw that through this most difficult third wave where we didn't have the degree of outbreaks that we saw even in a few months earlier, particularly in long-term care. And that's the good news. And because of the progress that we've made across the board here in BC and the fact that almost 80% of us across the British Columbia have received their first dose of vaccine, we're now at a place where we can more fully open and get back to visitation once again. So effective July 19th, we, through the safe visitation guidelines, residents and loved ones can safely reunite. So what does this mean? Changes in long-term care and seniors assisted living, the changes in the guidelines will mean that visitors will no longer need to schedule or book their visit in advance. And the expectation is that every facility will ensure that there are visiting hours that are available in evenings, at different times of the day, weekends, etc. And they will have people there to ensure that people are screened when they arrive. But each site will continue to maintain a sign-in list so that we do know who has been in a facility if and when we do have outbreaks. There will no longer be a limit on the number of visitors each resident can have, so now small groups of friends or family can gather together for a visit, and if people are visiting from other parts of the province for so long haven't been able to see their loved ones, they'll be able to do that without having to book ahead. An important change is that we do expect that all visitors, recognizing the risk that we continue to have in long-term care, will be fully immunized for COVID-19. That means 2 weeks after the 2 doses of vaccine. So visitors will be asked to provide proof of immunization when they arrive at a facility and will continue to need to wear a medical mask when they're in common areas. But they'll no longer be required to follow those infection prevention measures when they're in the room with their loved one or in the area with their loved one. And we can expect that these mask-free smiles will make a lot of people very happy. For those who are not fully immunized or who are not willing or able to produce their proof of immunization, the precautions that we have in place now will be continued to make sure that we don't add additional risk in our care homes. As the Minister mentioned, another change is that the adult day programs will fully resume. They had been limited in some areas, and so this will provide additional health and well-being benefits for seniors as well, of course, as for their families. And finally, larger facility-wide social events and gatherings will be able to be started again. Indoor gatherings include residents and staff across all units of a facility, while outdoor gatherings can now include family and friends as well. We know that these changes will be a big sense of joy and relief to many, many people. But we also know that some people will be nervous, perhaps feeling as though we're moving a bit too quickly. We have considered these things very carefully, and we will continue to be watching. And we've scheduled these changes to start on July 19th, so we'll have a good sense of what we're seeing in our community and the risk and transmission in areas around British Columbia as we've been monitoring through the next step of our restart. So we are moving these restrictions slowly and carefully, as we have for all of our steps in British Columbia. And we must, of course, continue to have the basics of disease prevention in care homes, and this will not change. That means things like not coming in if you're not feeling well yourself, making sure that you're cleaning your hands regularly, making sure that you're taking those general measures to prevent transmission of infection. And visitors will continue to be screened for signs and symptoms of any illness, including COVID-19, before their visits. And we'll be also bringing in some additional protections for people living in facilities. We will be implementing a provincial health officer order that will require facilities to provide public health with names and personal health numbers for all staff, residents, and volunteers, so that facility immunization rates can be determined by public health. And this will allow us to focus immunization efforts to support facilities where immunization rates are not as high as they need to be, and to ensure we understand outbreak risks and can work with facilities to take preventive measures. Workers who are not fully vaccinated will be required to adhere to the ongoing infection prevention and control measures that we have now, and that's relatively low. And the other thing we look at is the percent positive in testing, and that has come down in the interior, though it is higher than the very low rates we're seeing in many other parts of the province. So the proportion is really because it's come down so much in Vancouver Coastal and Fraser Health. But yes, it is concerning. It's still small numbers, and it's in several different focal areas. So as you know, I was able to spend some time with the team up in Kelowna to get a better understanding of what was happening in the interior, and I do feel that they have a strong public health response, and that they are managing cases, and we know where each of the transmission events is happening. So I do expect it will slow down in the coming days and weeks as we manage this and as we get immunization rates up. So it is clusters primarily in smaller communities where there's been an introduction and some transmission, particularly in pockets of unvaccinated people. So this is where we're focusing on our ground game, as Dr. Ballum likes to call it, is trying to get vaccine out to people. And that is a challenge, particularly in the north and interior, where we have many small communities, and of course right now where we have everything from wildfires to smoke as well to contend with.
And did you have a follow-up, Nick?
Yeah, can you speak to where you're seeing greater transmission? I know the central Okanagan was seeing higher than other places at one point. And are you seeing any transmission related to travel from out of town or out of province here in Kelowna? It's full-on tourism season.
Yes, I noticed that when I was there, that things were happening very quickly. Some has been related to travel, yes, from other parts of the country in particular, and mostly, again, in people who are not vaccinated and pockets of transmission. The central Okanagan has gone down quite a bit. The last I checked, and I'm sorry I didn't look at the CHSA level plots today. So the last ones I saw, there was again a cluster in a couple of smaller communities in the South Okanagan and along the border with Alberta as well. I think it was in Vermeer again that there's still some ongoing transmission. But I can certainly get Interior Health to give you some more of those details.
I just encourage everyone to get vaccinated. I think it's very important not to overstate a single piece of information. You'll recall, I think it was at the time of a modeling presentation by Dr. Henry, there were 11 cases in Grand Forks, and given the relative population of Grand Forks, that seemed like a lot of cases. Within a couple of weeks, that had gone down to 0 in the area, and in fact, there was no transmission in that community. So what we are seeing, and what we have seen in the last week or so, I think the 7-day rolling average is around 3% test positivity in Interior Health, and in the other 4 health authorities is now under 1%. Of course, that wasn't always the case during the pandemic. People know that test positivity rates were very high in Fraser and in Vancouver Coastal Health. So I think the message to everyone in the interior, and I think Interior Health's been doing a really good job of this, is that there are significant opportunities for first dose immunization everywhere in Interior Health. And it's important to take advantage of that and get immunized. It will not just keep you safe, not just keep your family safe, not just keep your community safe, but allow you to do things, including travel potentially to other countries. So it's time to get first doses, and for those of people who are ready to get their second doses have been invited, get your second dose. That is a significant way, and continuing to raise immunization levels, as we have been throughout BC, is a significant way to do that. And I think Interior Health has been doing a particularly good job at reaching out to communities. There are opportunities every day. Check out the Interior Health website about pop-up first dose vaccination clinics that are available to you, and get vaccinated.
Our next question is from Lisa Cordasco, Vancouver Sun. Please go ahead.
Thank you very much. I'm wondering what information are you ordering facilities to provide about resident staff and visitors, and others, and why is it important to determine the immunization status of those people?
Yeah, so one of our challenges has many challenges we have is understanding the immunization rates by facility, and that's not something that's easy to get because we provide immunization to healthcare workers and to residents in separate ways. So what the order will do is require all facilities to provide public health with the names and PHNs of all workers, volunteers, and residents. And then we can, in public health, cross-link that with our immunization registry. So the one thing we do have is a registry of all vaccines that have been given to everybody in British Columbia. So that way we can verify the immunization status of everybody in those facilities, and we can do that and create a database by facility. And it will take a bit of time to do that in the first instance to get it all together, but then we'll be requiring updating as there's turnover of both residents and staff in long-term care homes. So what this will give us in public health is that ability to understand at a facility basis exactly who's immunized and who isn't, and we will be targeting workers who are not immunized and making sure that they have all of the information that they need to make that informed decision about receiving vaccine or not. And if they choose not to be immunized, then we'll be ensuring that they continue with additional personal protective measures within the facility when providing care, as well as additional testing. So that is all how we're going to be working it out over the next little while. And while we have all of that information on an individual basis, being able to understand it at a facility by facility basis will be really important. And it is a partnership with us with public health in each individual facility to make sure that we do everything we can to prevent this virus and make sure that that residents and staff are protected.
Lisa, did you have a follow-up?
Yes, I'm just wondering if you have a percentage amount of the senior care workers who have been fully vaccinated.
I don't have it off the top of my head, so we do have aggregate numbers of the numbers of workers that we have in long-term care and the percent who've been immunized, but it is very high overall. It's in the high 80s for 2 doses. It's even higher, it's about in the 80s for 2 doses. We can get you the exact numbers, but that in some places it underscores, though, that there are pockets where it is considerably lower in some facilities. And so we need to know on a facility by facility basis. The rate of immunization in residents is even higher than that. 2 doses in residents is in the 90s. There are very few residents who are not been immunized, and there's good reasons why some of them haven't. But we have that at an aggregate level and even at a health authority level, but not at a facility level. And so that's what this new order will facilitate.
We have time for one more question today. Our final question will go to Lucy Jin, Omni News. Please go ahead.
Hello, Dr. Henry. As we see the infection number goes down recently, but we are also seeing the variants, especially the Delta variant, is in dominance. Do you have any concern for fourth waves coming in our province?
You know, we've been obviously looking at that really closely. The modelers and the team at BC CDC have been working with us on trying to understand where we've been watching what's happening in other countries, looking at the data of immunized, where transmission's happening. The UK is a country that we look at quite closely, and we have a good relationship with them, so we can understand some of the details behind some of the numbers there. What we are looking at with our program here in BC and really across Canada is our approach using the mostly mRNA vaccines, having the extended interval that allowed us to get a very high rates of immunization, and also across the board. You know, we started earlier than countries like the UK, for example, in immunizing younger people, teenagers and young people. So and we have very good rates, at least of first doses, and now moving into second dose in that age group. So these are really important things. The other important thing that we've been doing all along is monitoring vaccine effectiveness. So that helps us understand the level of protection in the real world that's happening. And I mentioned this in why we feel confident in continuing to open up visitation and in our long-term care homes is because that monitoring of how well the vaccine is actually protecting people is still very high, and we're continuing to see that it's good, strong protection. And today being on the first day in a long time where we have not had any long-term care outbreaks is a reflection of how well the vaccine is working as more and more of the population get immunized and rates of transmission go down. So we're watching all of that. Plus, we're looking at, as I've mentioned many times, we're doing whole genome sequencing of every case. So we do have a good understanding of where, what strains are circulating. We've had some blips in Delta. We've had still the predominant strains we're seeing are Alpha and the P1, I was Gamma. And we're continuing with our strong public health follow-up of cases to make sure that we're isolating people, that we're not allowing outbreaks and clusters to spread rapidly. So these are all things that put us in good stead, but there are unknowns as we move into the fall. So we'll be continuing to watch. Some of the modeling that we've done here and also across Canada shows that it's unlikely with the level of immunization we have that we'll see a resurgence, a large resurgence in the fall, but it may be pushed out into early in the new year. There are many, many things that we do not yet know. We don't yet know how long this protection is going to last, particularly for people who are seniors and elders who are immune compromised, who were immunized with a shorter interval earlier on. So we'll be watching that very carefully, and we'll be planning for if we need to have a booster dose at some time for certain populations, a third dose maybe in the fall. I think it's unlikely from what we're learning that we'll need to have a booster dose for everybody in the fall or even into next year, but that's only from what we're seeing so far. So there's still so much that we don't know. It's really hard to predict, but the things that we're following most closely are that vaccine effectiveness, so that real-world protection that we're seeing in even some of the most vulnerable settings. So there's a lot of studies that are coming out about antibody levels and whether the antibody levels are a reflection of protection or not is something we just don't yet know. So we need to do more and more of correlating those antibody levels with actual protection. And these are the things that the team are putting a lot of time and effort into, both nationally, and we were talking about that this morning with our Canadian Immunity Task Force and some of the work they're doing, and with our vaccine effectiveness studies that are happening across the country. And we are in a relatively unique position in Canada, not only because of the age groups and the interval that we've been using, but also because most of our immunization has been with mRNA vaccines, and we are doing the mixing and matching of mRNA vaccines with a longer interval. And there's a number of very elegant studies that are going to help us understand whether that gives people better protection, longer lasting protection, and those are the things that we will be talking about when we have more information as we learn more in the coming months.
Lucy, did you have a follow-up?
Yeah, yes, please. As we see, countries with higher vaccination levels are seeing upticks in cases and have already slowed down reopen due to the Delta virus. So do you think our province should do that too, to slow down a little bit?
Yeah, so again, what we've been looking at are the things that tell us if vaccine is working. And what we're not seeing is virus spreading rapidly in the community. So we have some Delta virus, it has been introduced into the community. We had an outbreak in long-term care, but the measures that we're taking are working against that virus as well as for the other viruses other virus strains that are causing infections and spreading in the province as well. It is in pockets where we have people who are unimmunized and having contact that we're still seeing spread. So those are the things that in public health we're following up on, trying to isolate people, jumping on clusters before they spread. But so far, we have not seen that it is affecting the protection that we're getting from immunization. So that's why the message continues to be, we all need to be immunized as soon as possible. We've seen a slowing, particularly in the younger age groups, and when younger people have contact with each other, as we're doing, as we're moving to step 3 of the opening up, we will see more cases, and it's going to be more and more important that all of us be immunized as soon as possible, and then getting our second dose as soon as we can, because we know that that's effective and it's working. Right now, even a single dose is working at protecting us from having widespread transmission of any of the strains that are circulating in BC right now.
Just really briefly in response to, I think, Lisa Cordasco's question earlier, we'll be providing to members of the media the aggregate data for immunization and long-term care and assisted living. We'll be providing that to all of you through the Health Communications Department, so that will be coming to all of you soon, the numbers referred to by Dr. Henry. And with that, thank you very much for your questions. Merci beaucoup, and we'll see you soon.
Thank you for listening today, and thank you for supporting us with our sponsors. Please go to depictions.media for more information, and click on our contact link and let us know how we can help bring your story and help bring us to a better world. This show has been produced by Depictions Media. Please contact us at depictions.media for more information.